Lyle Rich, Director of Neurosciences. I oversee the Neurosciences Department at Reston Hospital Center. The stroke program at Reston Hospital is a primary stroke center now, currently. We have an excellent streamlined award-winning program that we work in collaboration with EMS, both in Loudoun and Fairfax counties, to deliver excellent stroke care upon those early recognition of those stroke symptoms. So when a community member has signs or symptoms of a stroke, it's important that they call 911 immediately. That 911 center is going to dispatch emergency medical personnel. We work very closely with them in the ED here at Reston to have a very streamlined process to get them in, get them identified, seen by the specialist, the ED physician, and the stroke neurologist to identify those areas of stroke and can be amenable to treatment very early on in that process. We're excited to enhance our already award-winning primary stroke center here at Reston by adding a NeuroIntervention Suite that allows us to become mechanical thrombectomy capable. And we've done this with collaboration with MedStar physicians. Our outstanding program here at Reston involves our 24-bed intensive care unit, as well as our on-site inpatient rehabilitation facility.
I'm Joseph Watson. I'm a professor of neurosurgery, and I'm the medical director of neurosciences here at Reston Hospital Center. You know, one of the very most important things in all of neuroscience is stroke, and it's one of the worst problems in this country and the world, for instance. And just in my career, it's been amazing how much progress we've made. And the real progress has been recent in that we have these techniques where we can get inside an artery and pull out a blood clot. That's the most common type of stroke. There's an obstruction, usually a blood clot, something that's blocked an artery in the brain. And it makes perfect sense to take it out, and that will prevent or treat the stroke. But it needs to be done quickly because brain is dying. So that's why we're treating the brain now like we did the heart 20 years ago. It's taken us that long for the technology to catch up, but now we have it. And we have a brand new suite dedicated to that at Reston Hospital. It's going to really help. What was already good stroke care is going to be even better.
Yeah, my name is Dr. Rocco Armanda. I'm the Director for Neurointerventional Services at MedStar, Georgetown University and Washington Hospital Center, and will also be involved in directing services here in Neurointerventional at Reston Hospital. Yeah, so a Neurointerventional Suite is actually a type of an operating room, and a Neurointerventional Suite allows us to basically treat disorders of the brain by using catheter-based technologies, where we use dual X-ray, both from the front and from the side, and navigate tiny little devices inside the blood vessels to either remove the clot and improve blood flow, or to close an aneurysm if it's an aneurysm disease, or if it's a malformation of blood vessels, abnormal tangled blood vessels, we can use tiny catheters parked into the tangle of blood vessels, inject a medical grade glue, and occlude the tangle of blood vessels. And it's a team of us who do this procedure. It's not just myself as the operator or my colleagues. It's specialized nurses, specialized technologists, specialized anesthesia who all work together for the benefit of the patient. And this organized team basically works in sync with each other so that the goal is very clear, which is to restore blood flow to the brain as quickly as possible.
My name is Jill Tyroller. I'm the stroke coordinator at Reston Hospital. I ensure that all patients that come with stroke-like symptoms receive optimal stroke care. A good way to remember the signs and symptoms of stroke is to remember B fast. B is for balance. It's a sudden onset of dizziness, a lack of coordination, or just feeling off balance. E is for eyes. You can have problems with your vision in one or the other eye. F is for face. Look for weakness of one side of the face or the other. You can have someone smile and check to see if it's an even smile or uneven. A is for arms. Check for weakness on one or the other arm. Have someone just raise both of their arms together and make sure that they're even. S is for slurred speech. Make sure that they do not have any difficulty in repeating simple phrases. T is for time. Time is of the essence. Make sure you call 911 immediately. The sooner you get to the hospital, the sooner your stroke treatment will begin.